I have a few remarks, and so I want to begin by expressing my deep gratitude for the confidence that you all have placed in me as your new chair. This is both an honor and responsibility that I don't take lightly. So I'm humbled to follow in the footsteps of those who have led this council before, and I'm energized by the opportunity to work with each of you all during this year. The diversity of voices represented here is one of our greatest strengths, and I'm committed to ensuring that every voice continues to be heard and valued as we move forward together. Our mission is clear: to develop and implement strategies that not only address homelessness in Nashville, but work towards preventing it entirely. As we begin this new chapter together, I wanted to outline 4 key priorities that will guide my tenure as chair. First and foremost, we must continue moving our continuum of care strategic plan forward with urgency and accountability. It is a roadmap and it represents our collective commitment, and I'm dedicated to ensuring we maintain momentum that we currently have towards every goal and milestone. Second, I believe that we have an opportunity and an obligation to bridge gaps of trust between OHS and our service providers. I firmly believe in naming it to tame it, and addressing the elephant in the room. And so strong partnerships built on mutual respect and clear communication are essential to our success. And so I'm committed to doing some things this year that will bridge some of those gaps. Third, we need additional sustainability planning in the face of shaky funding, quite frankly. And so the sustainability planning that will meaningfully engage both our philanthropic and business communities. The scale of this challenge requires resources and partnerships that extend far beyond government funding. And I want to work with all of you all to build those critical and crucial relationships. And fourth, I would like to launch a visibility campaign, one that better equips all Nashvillians when they encounter our unhoused neighbors. Too often, well-meaning residents don't know how to effectively do this. And so we have an opportunity to educate our community and channel their compassion into meaningful action. So more will come of that. The work ahead won't be easy, but I'm confident that our combined expertise and commitment that we can build Nashville where homelessness is rare, brief, and non-reoccurring. Thank you again for this opportunity to serve, and let's get ready to work. All right, let's go ahead and do our roll call. Liz Mallard. Present, no conflict. Jamie Villegas. Okay, present virtually, I believe. Dr. Zendria Inslee. India Pungarcher. Drew Freeman. Please use the mics, or, yeah. Deanna Allen Robb. Michelle Southard. Andrea Hancock. Meredith Jolin. See her. David Langle Martin. H.D. Stovall. Catherine Knowles.
Present, no conflict.
Alyssa Fernandez.
Present, conflict.
Rico X, present, no conflict. Ashley Horton. Lizzie Goddard. Jahad Martin.
Present, no conflict.
Angie Lawless.
Present, no conflict.
And Deanna just walked in. Yeah, hey, for the record. Councilman Jordan Huffman.
Present, no conflict.
Councilwoman Courtney Johnston,
Present, no conflict.
Councilman John Rutherford. Okay. And now we would like to have a moment of silence for those deaths of people experiencing homelessness. There were 4 in July. Douglas Henson, Mark Holt, Lamel Evans, Travis Finch. Let us have a moment of silence. Thank you. The minutes for the July meeting were submitted with the packet. Are there any corrections? Yes. Good morning, Jamie. So an adjustment based on a comment around having an ad hoc committee on compensation of lived experience, if I heard that correctly? Okay. Any other adjustments? Is there a motion to approve those minutes with the said adjustment of Jamie? Okay. Okay. It has been moved and seconded. All right. All those in favor? All opposed? All right. Thank you. All right. This morning, we have some representatives from our housing division that want to provide a presentation and remarks on continued conversation around the unified housing strategy and its implications to our work as a council. And so I will have Director Hubbard speak with us today.
Can you hear me? Thank you, members, for having us today. I'm Angie Hubbard. I'm Director of the Housing Division with the Metro Planning Department. So we've got a very dense document that we released in April and has been updated after some feedback. That the most current version's on our website at nashville.gov/UHS. I'm going to run through this presentation in case you haven't seen it before. If you were at the State of Homelessness Forum, this is the same presentation, but I also wanted to let you know that on our website at nashville.gov/UHS, the respective various parts of the UHS are saved individually, and Travis Miller from my team has done videos. So if you don't have time or, you know, some beach reading to do to read through this, you can watch a video or even listen to it in your car because there is a lot of information. So I'm going to hit some high points today, the overview, just to level set and do some context. I want to save some time though for discussion, so I will likely run through a lot of the data and get to the strategies. And I think I've got 25 minutes, is that right? So somebody start flagging me maybe with 10 minutes to go so I can wrap up and give appropriate time for questions or discussions. So the overview of the UHS, this is what we mean when we're using this term. We have a huge ecosystem around housing in our city. We've got various different groups that meet often, even monthly, that are talking about housing. And so many partners working in this space But unless we are coordinated around and understand what the need is, what our resources are, we continue to kind of spin in a circle of everyone's competing for the same thing. Everyone's actually having different messages, and we need to get on the same page if we really want to collectively move forward. So the unified means that we are all, we have a document that lays out our data needs, our housing needs through robust data and community engagement, how we're using terms, the collective resources in our ecosystem, both through metro government, through the philanthropic community and private sector. When we're talking about housing, the Unified Housing Strategy is speaking to increasing housing supply, keeping the housing that we have, and then creating that housing stability for people when they are housed and connecting them to resources when they are experiencing housing insecurity. And then this whole strategy is is set to be responsive to market conditions. So this isn't a strategy that's living on a shelf for the next 10 years and not going to be updated. Every year, we're going to be revisiting the data. We have performance metrics for every strategy that will live on our housing dashboard, and we will track that progress publicly every year. And as we go through, we might be refocusing our annual priorities based on what's happening in the market. For example, if there is a housing recession, I don't want to conjure one up, but it's happened. We may need to pivot on our focus and where we direct funding. If there's a natural disaster, those happen almost annually. So those are the types of things we want to make sure that we're tracking through this UHS. There are many components to it. You will see an executive summary, which I think is in your packets. The Unified Housing Strategy has a lot of other sections to it, and those are the ones that have videos tied to it. We also have a 10-year implementation plan. Every single strategy, and there are over 40 actions, are laid out in an implementation plan for the next 10 years to identify what are short, medium, long-term priorities, the level of resources that are needed to achieve these, and who would be the lead agency. Because again, unified doesn't mean that just the housing division is doing this. There are some spaces where actually OHS has the lead, MDHA may have the lead, or even the private sector. Because there are some things that really impact our housing ecosystem that the government cannot influence or control or even intervene. And then we have recently published our first set of annual policy priorities. They're on our website. These are what we've been funded through the Housing Division to achieve during this fiscal year, as well as some policy and programmatic changes we'll be working toward. This is concurrent with some other studies, and forgive me, OHS, for not including the Homelessness Strategic Plan and HPC Council that you all worked so hard on, but concurrently with planning, we are having a housing and infrastructure study underway. That is looking more at the housing supply through zoning and infrastructure needs, the UHS, and then MDHA does an annual update to the consolidated plan. That's where they are talking about the use of federal funds for housing and community development. All of these things tend to be happening at the same time and can cause some confusion, and we're working through the UHS to try to acknowledge all of those. Before I start talking about housing, I have to remind everybody about the things we cannot do as a local government. We cannot require affordability as a condition of zoning. That has been preempted by the state of Tennessee many years ago, about 7 years ago now. Metro did have an inclusionary housing ordinance, and the state of Tennessee immediately passed the law that said, no, cities, you cannot do that. We have a little bit of relief through a voluntary program that we're working to set up, but a lot of questions that I do get is, and especially why you won't see this as a recommendation, why can't we just make every new builder include affordable housing? Because the state won't let us. The other one is we cannot do rent control in privately owned and managed properties. The only way that rent can be controlled is if there is a state, local, or federal subsidy in the program that says this project's income restricted, or units within a project are income restricted, and the rents can't be more than X, so that it's affordable to that income level. The other question we get is, this has happened in our market, in a hot market. You'll see an older apartment complex or houses sell on the private market to another buyer, and we lose that naturally occurring affordable housing, and sometimes people are displaced, and we cannot intervene in those private sales. And then finally, our state is not strong around tenant protections. And so again, we cannot, as a local government, require private landlords to establish tenant protections in their lease agreements. We do have some programs that can support tenants, like the eviction right to counsel program, but we can't be proactive in that with private landlords. So that's just why you won't see recommendations around these things in the UHS. Now, that doesn't mean that there aren't opportunities to engage with the state of Tennessee, but that will take a broad coalition of local governments, probably not led by Nashville, to have those conversations. So I also want to bring you to the term affordable and how we're using it in the UHS and how our team uses it. And it gets confusing. It's a very loose term that's thrown around a lot. The state has even taken it up on itself to define it for Nashville. And HUD has its definition, but how we're using it in this document and when we talk about it is housing that's income restricted, meaning there's some kind of deed restriction or other mechanism to where the rental units or the homes are affordable to households at or below 80% of our area median income. You won't hear us use the term workforce housing because all housing is workforce housing. You'll see me, I'm going to go to the next slide. Someone making full-time minimum wage, they're working, right? They're less than 30% of our area median income. So when people are trying to talk about workforce housing in this higher income space, we're missing out on housing for people that make our city run. Working in our service industry, in our hospitality industry, so many critical places. So we just like to use this. People get stuck on the AMIs, but really, when you think about the different occupations at income levels, and that's who needs housing. Oh, I seem to be stuck. Oh, maybe I'm not. Oh, help. I'm stuck. I can't seem to advance. Oh, let me see if I can do it on the screen. No. Oh, yeah. Okay. There we go, on the screen. So there are several key themes that elevated through the data analysis. We have an increase in housing demand. This is attributed to a bunch of different factors that I'll quickly review. I mean, no shock to anyone who lives here, but especially this group. We have a lack of affordability. We also have a lack of housing choice, inaccessibility of home ownership, risk of housing loss, and difficulty navigating programs and resources for people experiencing housing insecurity. So increased housing demand, we've got several different drivers. Predominantly, we're a hot market. We're very popular. We have a strong economy, so we have more people wanting to move here than we've really been building housing for. And we've actually had a drop in production. Overall, after the recession in 2008, we might start seeing some correction, but this is really constrained for households at or below 60% of our area median income, because the market doesn't build to that. It will never, even if we open up supply, and I'll talk about that in a minute, the market will never become naturally affordable with new construction for households at or below 60% AMI. So that's where we need to be focusing subsidies on for rental. It's about 80% AMI or even 100% AMI for homeownership right now. This just shows what across income levels, the compression of our housing market, and we need a healthy housing market on both ends, both for deeply affordable, that 0 to 30%, and even market rate, because when the higher income households don't have housing supply, and that's not what we're focused on building. What we're doing is telling the story of how our housing market works so we can understand how to have and where to have appropriate interventions. They are renting and buying in lower priced housing because that they can, and that eats up supply that could be more for that 60 to 80 to 100% AMI household. And so where there's not income restriction, they're taking up other supply, and it just compresses downward to where that supply doesn't exist. And we just can't build enough of that deeply affordable housing fast enough to meet that demand. So we have to look at strategies across the whole spectrum to open up that supply dynamic. Lack of affordability, again, short explanation, wages, incomes haven't kept up with housing costs. And so it makes housing unaffordable for both homeowners and particularly renters. It's very acute across different types of household configurations. You can see that the single parent household is by far more cost burden than any other type of household. And all of this data is on our website. And like I said, I'm running through it quickly to make sure we have enough time. Lack of housing choice is, we've heard this commonly, drive until you qualify, which usually puts lower income households very far away from access to jobs, transit opportunities, services, amenities. And it's also for households with other housing barriers, very difficult to find any housing of choice. And persons with disabilities, persons that are justice impacted, so many barriers place impact their ability to find housing. And then having a greater need for geographic diversity is one of the outcomes of, or one of the recommendations from this lack of housing choice. And then we also have a misalignment around the type of housing that we're producing and our actual housing needs. For example, we're not really building enough housing affordable to families. We're building studios, we're building 1 bedrooms, sometimes 2 bedrooms, but we haven't really been intentional about, even as Metro, aligning what we're trying to fund with what we actually need to build. So those are some of the things that we are becoming mindful of with this data. Inaccessibility of home ownership. There really is no or very little opportunity for any household that is making less than $100,000 to purchase a starter home in our city. There might be some condos here and there or some homes, but there are no neighborhoods, no real big supply. And so that continues to keep the compression in the rental market. Again, you can see inaccessibility of homeownership, also how it impacts different race and ethnicities. And this is actually reflected through Home Mortgage Disclosure Act data, where still Black and Hispanic families, even at the same credit score, income level, could actually have higher interest rates and other factors that make homeownership inaccessible. Risk of housing loss. This is a market value analysis that we had conducted as part of the Unified Housing Strategy. This shows the areas of Davidson County that are at risk for housing pressure. Either gentrification has already occurred to a level where housing displacement is happening, or it's at risk, and this helps us identify areas for targeted interventions. And then difficulty navigating programs and resources. There's not a single clearinghouse within Metro where someone can go and figure out if they've got a housing insecurity issue, where do they go? Where do they get started? And it becomes very frustrating. Someone in the situation is experiencing trauma and having to figure out how to navigate and call different departments. So we'll be working on coordination with other organizations to create a clearinghouse around that. Also, a limited awareness about all the resources out there. So that was a really critical thing that was lifted up during the UHS. So how much housing do we need? I don't know if the media's picked this up. Everyone has heard this. We need over 90,000 new homes over the next 10 years. This is across our whole entire housing market. And we believe that there is a demand for half of these to be homeownership, because we've had such a stagnant space for new entry points for home ownership for lower incomes. But our biggest gap is for households earning below 30% of our area median income. This is what we call deeply affordable housing. We will need to add about 20,000 new homes affordable to 60% AMI, with that priority for below 30%. And as I mentioned in this, the ripple effect is that compression where households in lower income brackets are having to rent up higher. Ooh, as I use my hands to hit my microphone, because others are having to come down into this part of the market. With that, I'm going to run through some of our strategies and actions, but also wanted to show you, this again gets to that whole housing continuum from homelessness all the way to market rate home ownership and the different types of interventions and threats that happen along those ways. So as you start with homelessness and supportive housing and affordable rental, that's where the subsidies have to come into play, in addition to opening up our market for opportunities for additional supply. Again, just reminding everyone who needs affordable housing, because you would be shocked how many people, no, you wouldn't. I just say that, but everybody talks about how unaffordable Nashville is, but when it comes to talking about affordable housing, you know the story, right? So we just remind everyone of who actually needs affordable housing by tying it to actual people and occupations and the people that make our city run. Here, our strategies are really, this is the big picture. We need to align our ecosystem and resources and have more resources in our ecosystem, preserve our existing housing, create new housing, prevent displacement, and connect people to resources. So that's where our strategies are focused. We don't have all of the key actions within each strategy listed, because otherwise we would be here all day and we would have 100+ slides. Our first strategy is focused on that, enhancing and aligning our ecosystem. Because if we don't have an aligned ecosystem, we're going to continue to do more of the same, which leads to more of the same. And we need to get folks on the same page, around the same data points, around the same messaging, and around the same policy priorities. And there's several things around this. It includes creating a position in the mayor's office for some executive level coordination across metro departments and other public partners that have a role in housing, aligning budgets and capital plans to housing and infrastructure and addressing homelessness, and then expanding our capacity to lead and implement housing initiatives. We also need to support our development partners. The next one is on, again, optimizing and growing our resources. Metro's budget is not big enough to fund what we need, even a portion of what we need. We are looking at other opportunities for utilizing what other resources that Metro might have available, but still, we really only come in at about, and best practices are coming in at about 25% in a deal. And that's really kind of a lot in some situations, in some markets. So we have to really call on the philanthropic and private sectors to step into this space. We don't have a good pathway for supportive services in our state. So looking at all of these things and how we need to talk about them and how we need to attract additional capital, how we can use other incentives and tools, and the way those incentives and tools are designed to achieve various types of housing. For example, people talk about creating revolving loan funds. That's great. A product where a developer has to pay back a loan, debt, does not work for deeply affordable housing in most cases unless it's mixed income, because those projects do not generate enough income through their operating expenses to pay back a loan. So we have to be very strategic in how we are actually utilizing our resources that we have now and reprogramming them to achieve some of these policy priorities, and then moving forward on how we approach new resources we might have. The next one is really about increasing supply. There's a number of things in here. The first one is about adjusting our zoning to increase housing supply. We don't get into that discussion in the UHS. That is through the Housing and Infrastructure Study. I refer to that and Greg Claxton as a general practitioner who's looking at an overall healthy housing market. We're more like the specialist focused on affordability. There are some new initiatives that we're working on, voluntary housing incentives. We are looking at publicly owned land and how to make that available for affordable and mixed income housing, and then prioritizing deeply affordable housing in the projects that we do fund, and really focusing on housing that meets the needs of vulnerable populations. Then we want to keep homeowners in their homes and also create opportunities for more home ownership. Again, some of that can be achieved through the increase in supply opportunities, directing public funds to households with barriers to homeownership, and helping to support existing homeowners through programs like owner-occupied rehab. But this is the one probably going to be of most interest to you all, is creating permanent housing options for persons experiencing or at risk of homelessness. So I started this conversation acknowledging that the UHS is looking at our overall housing market and the various interventions. We acknowledge that creating permanent supportive housing is so complex and it deserves its own focus, because it not only needs the capital, it needs the operating expenses and it needs the support services. We need to understand the right types of service providers we need to scale this. We need to understand the right type of development partners we need to scale it, because unfortunately, we do have some capacity issues to scale at the level of about 900 homes a year. And we really need a focus in on this. So we'll be working, there's a working group that the UHS calls for, I don't think we have it listed up here, of making sure the strategy is informed through persons with lived experience, development partners, service providers. So we'll be procuring a technical assistance provider to lead this effort, and you all have lots of opportunities to be engaged. So we're looking forward to collaborating with you, with the Office of Homeless Services, with MDHA and other partners. The next strategy is around preserving that long-term housing and stability, which is through different mechanisms. So two parts to preservation. One is keeping people in their homes through different types of interventions like home repairs. But another part is making sure that when they move, that housing still stays affordable. So we have deed restrictions for Barn Fund projects, but there are other mechanisms like ground leases on metro land, community land trust for some shared equity home ownership. So those are some of the ways to keep housing affordable, that after, a few years, somebody moves out, it's still affordable for that next buyer or that next renter. Then the last one is strengthening housing security. Oh, wait, yeah, that's the last one. For renters, and improving that access to resources for all Nashvillians. This is what I got started with, talking about. People don't understand or realize all of the resources that are even available through Metro, much less our other private partners, how to access those. But also we do have the opportunity to introduce some housing security measures for tenants in the projects that we fund. And we've started doing that through some Barnes Fund programmatic requirements, such as no increase in the tenant's portion of the rent during the annual lease term, things like that. We're starting to require all Barnes Fund rental projects to give us an eviction report every year, so we can start analyzing what are the causes of those evictions, making people aware of fair housing rights, and supporting the eviction right to counsel program. So those are some of the big actions from that strategy moving forward. And this is a QR code if you want to scan it to our 10-year implementation plan. All of these documents are discussed much more robustly on our website at nashville.gov/UHS. And then I mentioned at the very beginning, this whole document is to respond to market conditions. So priorities today may not be priorities of next year. And that's why we call this a living strategy, to be reevaluated, stay continually engaged with the public. We had some great community partners, some community ambassadors that are engaged with a whole diverse group of residents all throughout Davidson County, and keeping in contact with them, continuing to have community conversations, because the data is always behind what's happening in our community. The people feel it first, then the data is about 2 years later. And so that's how we will keep a pulse on that, and then prepare these annual policy priorities at the beginning of each fiscal year. So I don't know where I'm on time, because I avoided looking at the OHS table. I don't know if we have time to open up, or if you want us to come back at another time to answer questions, but Chair, I'll turn it over to you on how you want to navigate the next step.
I'll allot time for one or two questions, if anyone has.
Do you mind? Thanks. So when we talk about the need and it says 90,000 new homes, is that in just Davidson County or is that in the area around? Because you're using AMI with a 10 county average.
The 90,000 is only Davidson County, and it's not income. It's across a whole range of incomes. The AMI that we use is because even though it is a 10 county standard for income targeting, that is the typical measure in all the other housing, state, federal housing programs that are always layered in with the Barnes Fund or other local sources. What we look at, though, council member, is where is Davidson County actually at in that AMI scale? So, for example, the census publishes a county-only median household income number. It's always about a year behind our AMI release. But when we look at that, we can actually see about half of Davidson County residents are actually below that 80% AMI. So when we look at income targeting, we're scaling the AMI target to meet Davidson County residents where they are. I know that sounds like a complicated explanation, but we're not just saying, oh, we know our AMI is skewed because of surrounding counties with higher incomes. We know that. And so we're saying, we really need to meet people at that 60% and 30% space and not just keep it at that higher income level.
Okay. Because I think when we looked at the infrastructure study, they were also saying, 90,000 units or homes, but they were looking at the need in all of our surrounding counties. And so Davidson County need was a portion of that. For sure. So I'm getting conflicting information because I just want to make sure that we understand what we actually need and what we can do here in Davidson County. But it doesn't make sense to me to have an average. If you're looking at the need specifically for Davidson County, if you're using these AMIs from places like Cannon County, like that, in that 10 county thing, that doesn't make sense to me. I mean, it makes sense in a certain way to say the collar counties, but you've got counties in here that are pretty far off, that I would think would skew that number to something that's not realistic.
We'll confirm it. I believe HNIS was also Davidson County. Yeah, because we're using the same data in both of those studies. But if there is conflicting information out of HNIS and UHS, we'll make sure and clarify that and have that publicly available and also get back to you to clarify.
Is she?
Almost. Bradford, thank you. Does our state law prohibit the encouragement of situations that allow for sales of property to create these opportunities? I ask because there's a property at 605 Stewart's Ferry Pike in Donaldson where a legacy church has sold 22 acres that will be a mixed-use development, and that church, whom I happen to be the founding board chair of, stipulated that there be workforce affordable housing within that sale. And so I'm pretty tired of being told we can't do things and more interested in looking for ways that we can strategically do things. Even if we can't force something, can we incentivize, can we provide toolkits, et cetera, et cetera, et cetera. And I would yield my time to Councilman Huffman, who assisted in that sale and is it an SP, I believe?
Way to put me on the spot. So yes, that rezoning was an SP, and to be clear, it's not written in to the zoning ordinance. We can't do that legally. But yes, there was an agreement. And unfortunately, that's the only tool that we have from the zoning mechanism is finding a good developer that's willing to contribute to the solution. Now, I will say the one thing that Director Hubbard pointed out that is really important here is this is only at this point in time. And if 2 years from now, this developer could completely change their mind and go back to normal rates. So it puts us as lawmakers on the local level in a cumbersome position for sure. So I agree that there are opportunities, but we're still we have our hands tied a little bit by the state.
I will say any private developer can put stipulations on the sale of their property in their agreement, whatever they want to do. We are also will elevate, we're standing up a faith-based development institute to help educate and support faith institutions that are looking, because that's actually our biggest landowners in the county. And they're very mission driven, but we have to have a lot of carrots, a lot of different types of carrots to support and incentivize, because dollar signs do speak very loudly to a private sale.
Here to carry that message to the United Methodist Church for you, please.
Great, thank you.
We're going to move forward. I was just informed that despite the fact that we don't have any action items, by law, we do have to call for public comments. And so if there are any public comments, you can please step to the podium back there. Okay. Just doing my due diligence. All right. Next, we have a couple of new business items. And one, I want to yield some time to Grant Winter and Deshaun Reed, who will give a summary of the coordinated entry policies and procedures manual, just with revisions. And then please note that this will be, we will have this for review, and it will go for official vote on the next HBC meeting. But we wanted to have a brief presentation on just the work that's been done up until this point. And so just kind of, I'll yield the floor to Grant and Deshaun to give us a summary of it.
I appreciate that, Chair. Good morning. I am Grant Winter. I work at Safe Haven, and this is Deshaun Reed from Park Center, and we both co-chair the CE Oversight Committee. Appreciate the time to be able to come speak to something that our committee has been working diligently on for many months, along with OHS's CE team and other staff. So I just want to start by thanking the CE Oversight Committee for all the hard work that was done, Monty and her team, and Raquel for all the hard work that was put into creating a document that I think we're really happy with. So again, I know y'all have only had this for a week, and so I can't imagine many of you have read through the entire thing up to this point, so that's why we wanted to give another month. But just wanted to speak to some specifics and kind of at a high level of some of what we look to adjust from the previous draft. Again, this is a document that we update and draft annually. So this is always a living document and something that we're always looking to improve and adjust. So this is a draft that we feel really good about, but knowing that there are going to be new things that we need to add and adjust in the future. So the CE Oversight Committee, just to give a little history, is a new committee that was formed by the HBC last year. And so we've worked a lot in the last year to determine what our scope is as laid out in the charter, and what our role in the COC is as ensuring we are always creating a stronger CE process for our community through robust partnerships with an oversight of OHS as the CE lead. Because this is a new committee, we look to incorporate some new things in the document that kind of created roles for the committee as it relates to policies, procedures, and practices. We received a strong showing of public comment this time around when we put out the initial draft public comment, which really helped to inform some of our discussions and throughout the process. One of the big things that you'll notice is just the overall formatting of the document. I think if you look at the table of contents at the beginning, if you compare it to the previous draft, it's a lot easier to kind of read through and process all the different sections. We really hit on kind of the four main key elements of CE: access, assessment, prioritization, referral, and really organize it all in those pieces. Let's see what else. Also, just want to name that CE isn't just one agency's responsibility. The CE process is our entire community's, and this document is one for our entire community. And I believe it does a good job at describing kind of the roles and responsibilities about everybody involved, ensuring that we have a strong and effective process. So, I wanted also to note that DVCE also has its own policies and procedures that the Mary Parish Center writes and updates as well. So there are references to DVC in this document, but they also have their own robust policies and procedures. Just a couple sections to note. Again, I think we laid out kind of just the overall purpose and goals at the beginning of the document to lay out some good framework. The roles and responsibilities section, again, I think does a good job at laying out the role of CE lead, participating agencies in our committee. And then there's not a lot of other specific ones that I'm going to necessarily point to today, other than one section Deshaun's going to talk to that we had a lot of robust discussion around, especially in the last few meetings until we voted on this. I know there's going to be some questions around that, and then we can also come back for sure after y'all have another month to digest the document and answer some more specific questions around that. But Deshaun's going to speak to one specific section and kind of how we got there to some of those updates. And then we can take any questions today. And then again, obviously, y'all are voting this today, and we're happy to come back next month as well to speak to it. And if there's anything that I'll defer to Monty and her team on maybe some of the things if I don't have the specific answer. So.
Thank you, Grant. So as Grant mentioned, we opened this up for public comment, and quite a bit of our public comments were about prioritization and encampment closures, and how do we handle that as a CE community. And so, as Grant said, we kind of went back and forth for several of our meetings, kind of trying to workshop the language to make sure that as a community, we're doing the best for the people that we are trying to serve, but also recognizing that we have limited CE resources, and how do we best do that. So we came to kind of the decision that any encampment enclosures and prioritization changes will go through the CE Oversight Committee before those changes go into effect. This allows for the community to kind of have some oversight into how we use those limited CE resources. This does not limit the CE lead from using non-CE resources to help serve those individuals who are in encampment enclosures or in different prioritization, but it just kind of provides some oversight to those CE resources. So we still have that flexibility and that nimbleness to address the needs as they arise, but we're trying to create a more equitable and person-centered focus. We understand that that kind of goes in contradiction of the outdoor homelessness strategy. And unfortunately, that was created before our committee existed. And so one of the things we discussed was sitting down and having our committee have a part of that, right? And have a part of how that looks. We know that there's changes coming that we need to be nimble for, and so we want to make sure that we are effective. So you'll see an entire section in the policies and procedures manual that kind of goes over our different expectations and how that is going to operate. But that was definitely a big section where the community at large had a lot of comments about.
I think that's kind of the main things we wanted to point out. And again, I'll just name, like, this is a living document. All of our COC's documents are living documents. And so as we're always updating them, we know that like when the outdoor homelessness strategy was created, it was a new document, and other documents had to then be changed to reflect it. And so as we're always wanting to improve what we're doing as a COC in the community and serving individuals and households, we believe that this is a good draft that helps get us towards that. But happy to answer any specific questions on any of the document or sections or changes.
Councilman Huffman.
There we go. Thank you. Thank you, Chair. Just a quick comment on the appendix, and I know this will take some coordination with Office of Homeless Services too, but there's two big gaps that I see on outreach access points. One is my side of town, so Donaldson and Hermitage. That's a big one. And the second one's Bellevue. So just want to highlight that. We do have significant unhoused populations in those areas. Thank you.
Great. Thank you.
So I will say, we went back and forth about including the outreach access points because they change kind of frequently. And we talked about potentially adding a section where like it could live on like Hub Nashville or somewhere where people could go in real time. And so that is an area that we kind of went back and forth on whether or not including. So we can definitely take that into consideration.
I just have one quick yes or no. The grievance procedures on page 23, that's new, correct?
Yes, I believe, and maybe I'll defer to Monty. I know her team worked on this section as well. Some of this existed, but I believe there were some adjustments. And then there were some things added in the continuous improvement and evaluation around kind of concerns around the CE process.
Thank you. Just trying to connect. I remember hearing that there was work in one of the subcommittees to work on a grievance process. And so just trying to understand if the two are related.
Any other questions or comments? Two more. Alyssa.
In one section, it mentions for clients, they're required to check in once every 89 days. And then later on, it talks about every 90 days. So I'm just trying to understand what the discrepancy there. Why is one 89 and the other is 90? What's the difference in that situation? Otherwise, they become inactive in the system. So it's just kind of an important thing to understand why people may not get access.
Yes, we will address that. It should be every 89 days because if it hits 90, they will become inactive. Would really like for people to be doing it closer to 60. But I also want to make one clarifying comment that there were not a huge amount of public comments. There were 4 or 5 individuals that specifically made comments on this entire document. I just wanted to make sure everybody was aware of that.
And on this same thing, so when the 90 days hit, is that automatically in the HMIS system or is some like a worker going in and like, I guess, discharging people?
There is a process that happens with the HMIS team and when they will be exited from CE and then they will eventually be exited off the by name list as well.
Okay, I'm thinking about safeguards for just HMIS user errors. So like say if a client 88 days in does a check-in with their person, but the worker for whatever reason, I don't know, it's a weekend or things change, they don't get to it, and now they're like automatically out the system and now they're not on the list to be considered for housing. So is there like safeguards for that kind of situation?
We really would like it to be 60 days. That way you have a good 29 before they are exited. And that is usually our suggestions to the community. That is what the CE call team tells people when they reach out. So that is what we safeguard, and we are happy to incorporate that in here. But we did want to be clear on what that actually is in HMIS system. But we can change that to, I'm happy for suggestions, but we do say 60 days when we talk to people just to have that built-in safeguard.
Yeah, and I'm thinking if like 60 for the community, I get well like another 30 days where the actual system that's the safeguard. You have like a grace period afterwards. But as far as what's being sent out to the community for them to understand,
Yeah.
it probably makes sense to go ahead and put an earlier date of check-in. Thank you.
One more, then we got to move.
This is maybe more of a request, and I'm not sure if this is just the CE oversight, but I do appreciate the language around oversight and making community choices if we were to change priorities. I did just flag for me if there are resources that are not going through coordinated entry, which we know is happening for encampments. We have the non-exhaustive list on page 19 of what may go through coordinated entry. It would be helpful to have a bit more detail if that's all of our continuum of care resources, but then we also have our MDHA vouchers, so it's not just our COC competition. It would be helpful to understand what is actually flowing through CE and what is not, for the intention of that there shouldn't be a wrong door for folks to access resources, and if there are things that are not going through CE, also having transparency about that as well. So maybe if we could add in project layers as well, that would be helpful. Thank you.
So I want to thank the committee for your work over the last several months, and I just encourage everyone to review this in more details, and then we can come back next month with any additional questions or comments, and then hopefully approval. Thank you.
Thank you.
All right, we have a couple of pieces that were brought up during the executive committee meeting. And so the first is I'm going to bring up Allison, who's going to talk about alignment between the strategic plan and our application, consolidated application.
I'll try to move quickly. Okay. So as the chair said, at the last executive committee meeting, the members talked about moving forward with our strategic plan. We also talked about the NOFO, which, later on in the agenda, I'll go in more depth for my update. And we talked about the community application that goes along with the NOFO. That community application is meant to capture all of the work that is happening in Nashville. So that's COC funded agencies, it's non-funded agencies, it's agencies that aren't even part of the COC. And the score for this community application determines the funding amount for our COC from HUD every year. HUD gives us feedback for some of those scores, for other some of those sections. For other sections, we don't even know how we scored. HUD just sends some scores for some sections, and you just do the best you can with that limited information. Now, a huge portion of our score comes from data. The system performance measures alone are 30% of our score, and y'all have a handout in your packet with the SPMs. If you want to see where those numbers are coming from, and I know Chantel's going to do a deeper dive into that, but 30% just comes from the SPMs. Other, pieces of our score come from other sort of concrete data, things like the housing inventory count, the longitudinal systems access. What's the A stand for? LSA? Analysis. Thank you. Longitudinal systems analysis. Our bed coverage, that all is part of our score, a large part of our score. But some of the questions in the application are not those kind of hard data questions. They're about strategy to improve different aspects of the work. And so obviously those strategy questions intersect with the strategic plan, which is a great point for collaboration, because some of these strategy questions could definitely use improvement. So I wanted to start sort of putting this in front of y'all as we get ready for this year's NOFO. I pulled a few questions from last year's application and our answers. Now, keep in mind, these are a year old, so they may be a little bit stale, but I highlighted which part of the strategic plan I thought that these questions and answers would fall under. The questions that I picked are things where, like I said, I think we can make improvement. Questions around infectious disease prevention, how public health information is communicated, making sure that services for DV survivors are trauma informed, and that our COC has an emergency transfer plan. You have this in your packet. I'm not going to read it all to you because I know we don't have time. And those are three questions that make up this gigantic application. But I wanted to get these in front of you. We would love any suggestions for ways to improve our answers, or if you know of efforts that are going on in the community that are not being highlighted, please let us know. I know we do have character counts, those pesky character counts that limit how much we can write. But we want to improve our strategies and improve our implementation. So we're going to be bringing more information about the community application to y'all in future meetings. Always feel free to contact me if you want to discuss the application or if you have questions or suggestions or if you want to contribute to this year's application once the NOFO drops. I know that was like lightning fast, but you have those answers in front of you. And so just feel free to contact us if you have suggestions, because I think the community application really needs to be everyone working together to capture all of the great work that's being done. Her question was, can we share the whole application from last year? And yes, it was sent in the email to y'all before this. I did not print out the whole thing because it's like 150 pages. Yeah. All right. Thanks, y'all.
Thank you, Allison. The next thing that was discussed in the executive committee meeting was moving from just reports that kind of talk about the amount that has been spent down as it relates to funding, and also and really getting a grasp on the actual outcomes of funding agencies. And so briefly, I'll have Chantel just kind of comment on that, but this will be kind of a component that we'll look at, and not so much from a punitive perspective in terms of, overperformance or underperformance, but more so, I think, really honing in on like what is really working and how we can capitalize on that in subsequent funding opportunities. Chantel?
Hello? Okay, perfect. So everybody should have in their packet, it's titled HUD System Performance Measure COC Funded Projects. So that is going to have every COC funded project broken down as it relates to the system performance measures. Just going to highlight a few things. The reporting period, that's going to be October 1st of 24 to July 31st of 25. This reporting period is what the start of the SPMs are. And these dates align with the reporting period we submit to HUD. Like Allison said, this can account for 30% or more of the points in the annual funding competition. And so it could be anywhere 30% upwards, 40%. So it just depends. All of the data that is submitted is coming from HMIS. All COC funded projects are required to participate in HMIS and put their data in. So that's where that's coming from. Another thing to note, measure 3 and 5 are not included in this packet because those measures are relevant for system-wide and not necessarily project-focused. And this is going to be project-focused. This is project level. We go to measure 7. It is dependent on PSH or RRH of how that is reported. So we just want you to take note that those are broken down. You'll see 7B, 7B2 of how that's reported out. Not included in this is Mary Parish data. That data is not in HMIS, obviously, because they are DV projects. So they're not included in this report. Also OASIS, they have a supportive services project, and it's not a housing project, so therefore they're not included in this as well. Overall, the rapid rehousing returns are lower. They are best positioned for this and being successful in this because they are paying rent. So it's going to look more successful for rapid rehousing projects. Just to note also that there are different expectations for different project types. So for our permanent supportive housing and our rapid rehousing, it's not completely comparable there. It's not apples to apples there. So the outcomes are going to look different because they're different project types. Lower down the returns to homelessness, you will see some NAs there. This measures for 2 years ago. Some of the newer projects, we don't have that data because they're newer projects, so we don't have data from 2 years ago. So that's why you might see the NAs there on that data. So the information is just not there in HMIS to be reported on just yet. Same for the income stayers. It measures over the last year. Some of those projects have not been running for a year, and so therefore we don't have that data to report out just yet. But all of this is in your packet, and this is going to be something that we are going to continue to report out on so everybody can see how the COC funded projects are doing related to the system performance measures. Anybody have any questions? Darn.
Thank you so much. Data is what drives all the change. What gets measured gets managed. So thank you so much for providing this. Can you tell me really quickly, I'm sure you said it, but I missed it. Are we, the HPC, the intended audience for these metrics?
I would say the intended audience is like the community. I mean, this is a report that's done every year to HUD that HUD requires us to do. This is the first year that we've really broken it down by COC funded project. I think it's helpful to see how we are doing, on a system level and then breaking it down to project-based levels for our community to better understand where everybody's at. And it also holds some accountability too. We can really see what the COC funded agencies are actually doing.
Yeah, no, thank you. Is this the time for me to make some suggestions on how this would be?
Yeah, sure.
Okay. Again, thank you. Some things I've noticed is it is very difficult, near impossible to understand what the N is of participants. So it would be really helpful. I think what the N is where it has like a percentage/12 maybe, or like percentage plus a raw number. And it's difficult to know if that is like 14% equals 2 people or 14 plus 2 people. Also, it would be really helpful for context if we had some sort of target or benchmark that we were able to look at this and quickly identify whether the numbers here are positive or negative. Because I'm not sure by looking at this, like this 44%, is that good or is that bad? Then I think maybe having some comparison where it's like people exiting the program who increased total income, maybe some parameters on, is that during the program participation? Is that post? Then I think too, data is really important to community organizations, especially now as we're all, trying to understand funding options. And so maybe making this document a document that is in plain language so that the community can also interpret the data that's here to help them as they're applying for their own funding. Yeah, okay, sorry. Thank you.
Thank you. We appreciate your feedback. Yeah, let me go to Allison.
Just one little piece of information to what you said, sort of knowing, are these numbers good or are these numbers bad? This year in our application scoring, and again, they give us very little information, but it does seem like the SPMs where like we did better than last year, we got more points, and the SPMs where we did worse than last year, even if it was a teeny percent, we didn't get a percentage of points, we got 0. So that's kind of what we're comparing to, is what were the numbers for the community last year? Did we improve or did we decrease? And in the past, I don't think it's been quite so like, oh, you decreased a little bit, 0 points. So that's just something to keep in mind.
Sorry. So that would be a benchmark, is what you're saying, is being able to see what we had, what was reported last year. Is there a benchmark of like best practice?
The best practice benchmark, I would have to dig into that, but the benchmark that they're looking at is the community-wide, right? So like what goes into the application is the community-wide SPM. And so that's, all of these projects together.
Yes. To your point about the accountability piece, us knowing what a national benchmark is going to help us determine not just, I don't know if last year's numbers were good or bad either. So having something to compare that to gives us the ability to really evaluate.
Deanna?
No. Oh, good morning. So just a quick point, because I serve on the PEC, the Performance Evaluation Committee. So this data is a little more familiar to me. But what my brain did was it went to the HMIS report, and I immediately looked at the average length of time from HMIS entry to permanent housing, and that number being significantly lower than the SP, our system performance. And I'm not making a connection between the two. If HMIS, length of time from HMIS entry to permanent housing is 88 days, I recognize that's a point in time, that's 1 month versus several months of system performance, but we are averaging well over 90 days. How are these two pieces of information connected?
I think that one thing that we have to keep in mind is that the information that is in HMIS is going to be all participating agencies, which we have 40 plus, 40 plus participating agencies who enter data into HMIS. And so that is going to be a very big picture of all of our data. And what you have in front of you are only COC funded agencies. I hope that answers that question. Oh, yes, and the point that April has made that is that this is looking over, it's over 2 years old at this point.
Appreciate those comments and questions or for feedback. Again, I think this is just a step to where we really wanted to get a handle on the actual outcomes and the performance. And so we appreciate the work, and we'll continue to modify the report to make sure that it's clearer for everyone involved. Moving forward, I have COC report. Kenna?
Hello? Can everyone hear me? Okay, cool. I will go as fast as I can without talking too fast. I'm originally a New Englander, so I'm going to try and go for moderate speed. So just a reminder that our next COC meeting is Thursday, August 21st at 10:30 at the Nashville Rescue Mission. If any of y'all are able to come, we certainly encourage it. So I wanted to do that. I don't need to update you on the last one because I did that last month. So we haven't met in between last month and this month. I did want to point out some of your COC committee updates and just kind of some highlights from them. So if we're looking at the charter committee, there's been a talk about what the charter committee is working on. So I want to point out that they are actively exploring the possibility of moving the lived experience committees and or all COC committees out from under the Homeless Planning Council in the charter. So I thought that was important for you guys to point out because you are the Homeless Planning Council. So definitely want to look at that. They're also looking at different things that need to be revised. So their next meeting is August 25th at 1:30. So if you are interested in that, you can certainly attend because they are open to the public. Standards of care, as well as the Data and HMIS Oversight Committee, have been meeting joint both last month and this month. We are working on a actual definition of supported services for the overall community because it's referenced in strategic plans, but we don't actually have a definition of what that means. So we're looking at that, but we are also working on the strategic plan that talks about community-wide inventory. And so there's a survey that is going to go out to all communities that provide outreach and or housing. And so the standards of care and data and oversight are working together to create a survey that will go out so we can actually more appropriately see what kind of outreach is provided, how many outreach workers are provided, and same for housing, what kind of services, so we can be able to look at if you're providing supported services, is that to people who are in housing or not in housing, that kind of thing, because there's a lot of talk about inventory on how do we work with people to get into housing. You need outreach workers to do that. How do you maintain housing? You need supportive services to do that. So that is a big one that's out there. Trying to see if there's any other ones that I should plan. There is now, in returning back about the talk about the 4th of July fireworks, there is a subcommittee off of the SWAP that is meeting to talk about encampment closures and kind of following our plans and basing on best practices from the National Alliance to End Homelessness. So that is a small committee that will be only meeting through October, and then we'll be presenting their findings. And so you guys will get that on kind of doing some research based on how we do have, it's an interim housing strategies subgroup. So we will be getting that in the next couple of months. We are doing a small committee to kind of just really target some what we have, what the data says we should be doing, so we can report back to you kind of where we stand as a community and what the suggestions should be. So that's out of SWAP. As you've heard, there is a discussion about a notice of funding opportunity or NOFO being dropped by HUD. So the PEC is gearing up for that. I know we don't have a date on that yet, but I know that other local agencies are trying to prep, and so is the PEC in regards to that. I know I'm making little noises to myself when I go fast. The other thing that the data and HMIS oversight is exploring granting access to HMIS to mental health cooperative staff within the DCSO Behavioral Health Care Center. So that is just something where it would be not, I want to point out that that's not the sheriff's office or any law enforcement having access. It's the social workers through mental health co-op within that would get access. So that's something that's being discussed at this upcoming data and oversight committee, because that would be kind of the closest we've gotten for HMIS being like very, very close to a law enforcement. So if you're interested, join our joint committee. And I think those are all the really big things that I was noticing. You have this in your packet to go through and make sure you get all of that. There is also going to be an upcoming all chairs meeting, so you will get that update as well. And I know that there was some feedback that I brought to you all. So my question more so now is there anything that you want me to bring back to the COC general membership so that this can be more of a conversation? Awesome. Well, other than that, what I am, you guys have in your notes, the summary of the questions that were brought to you last month. Moving forward, we're going to be more targeted on getting you like an actual form after we meet with the COC that you can see, like a separate document that says questions for HPC from the COC, so that you guys have more time to read, have a response, and it can be more of a conversation as we move forward. Any other questions? Have a great day.
Thank you, Kenna. And just a note, I think on one of the, I know that the COC asked about some sort of committee as it related to the compensation of lived experience. And I know that some of that conversation is happening in the governance charter committee. So I think just as a report back to, that'll be an item of discussion for COC. And then also, I think for the next all chairs meeting, I would like to make sure that we have some level of conversation and coordination between the work that the coordinated entry has presented today, as well as the encampment strategy that was previously approved by the SWAP committee. So just making sure that there's as much synergy as possible. So that'll just be something that we'll make sure that we have some conversation at the all chairs meeting.
Absolutely. I really want this role of what I'm doing to be more that all these subcommittees have an opportunity to submit those questions so that they can come here and they can also come to the COC, because I think that goes for our overall goal of just really having synergy and continuous conversation. So it's not that you don't know what your right hand and left hand are doing at the same time. So thank you.
Thank you. All right. Brief updates from OHS.
I noticed that you said brief before calling me up. I do want to clarify on some of the data questions. Back to Deanna's question as it relates to the length of time being homeless. The thing that you all get from HMIS is per month, clarifying this with Kelly. And then also this systems performance measure, it's not actually 2 years. That's what we submit to HUD, 2 years worth of data. But the dates on this one is on the top. So it's maybe not even a year at this point. So want to make sure that we're bringing you guys some really good, clear data. Also, I think there was a question around benchmarks. So definitely there's some national benchmarks that we can put on this document to compare. I think some of the other questions would be community benchmarks, which is what Allison was getting at on how our community gets more money based on our community improvement. And then there's agency projections, which I think is what the executive committee was asking more for. What were the agency's projections based on their application that was submitted to HUD? So we're trying to have one document that combines all of this stuff. Going to get a little thicker and a couple more pages longer, but I think it's worth it just so that you have some things at your fingertips. Also, as it relates to the ARPA funds, I just want to share that this document is changing. We're looking to, one, add some of that data to this document as well. All of that I just said, even though it's not a COC funding document or COC funded capacity, I guess I'll say. But we wanted to make sure to add that information to this document. So it's going to change. Also, it's going to change a little bit because there was some ARPA funds that were distributed to our department and MSS prior to us becoming a new department. And we're looking to kind of combine that scope of work here with the data and the numbers as well. So that information is going to change here shortly. Going fast because I know you said brief. Seasonal concerns. Some seasonal concerns is, last night there was really bad thunderstorms that I had no idea was coming. But I worked closely with Director Chief Swan and OEM, and they send out reports. And so what we want to make sure to share with you all is that we'll send those reports along. But there's also a way that you all can register to receive those reports from him as well. That's open to the community. And then even heat response. We used this year, for the first time ever, we used the MEAN system, which is a Metro-funded system that allows for mass communication. And we were not aware that after 1 year, you have to resubscribe. And so we had to have a stern conversation that says our population that receives this, they're not going to always be in a situation where they can annually subscribe or resubscribe. And so they changed the system for us by way of Tatiana Ruffin, our emergency services manager. She didn't take no for an answer, and they were able to change that system for us. And after this time of re-enrolling, no one will have to re-enroll again. So you'll receive it until you say stop, of course. So that was important to note, and you'll see that here. Couple of other things. We are hosting our landlord engagement team is hosting a shared housing training, and they're receiving a certification from the Shared Housing Institute, national level. And they've already done a training with Room in the Inn. I think they're planning one for the Nashville Rescue Mission for shared housing. Got to have some creative solutions. We can't just be one size fits all as far as housing is concerned here in Nashville. And so, and then they're also hosting 4. It was initially going to be 7 trainings. We condensed it to be 4 so that we can train community service providers and landlord and property owners who are interested in doing shared housing. And even people that are already conducting shared housing can come to kind of learn what's going on nationally in that space. Very last thing that I would like to highlight is we received an award through Community Solutions for a veteran systems lead. And we hosted interviews, and VA came over to our office for 2 days, sat with us to help. Jaha Martin sat with us to help with hosting interviews. And I would like to say by far there was a resounding yes to one candidate. And this is probably the first time it's ever been announced, definitely ever announced publicly. Kelsey Combs, would you like to stand? Kelsey Combs She has been working with our CE team. She comes to us from multiple nonprofits here in Nashville and fully understands CE. What was important here was not just to understand homelessness, not just to understand coordinated entry, and not just to understand veterans, but to add all of those together with understanding Nashville. And so she's got some big shoes to fill because that is really a position that is designed to help with reducing and ending veterans level homelessness. So looking at gaps analysis strategy. I see Councilman Rutherford making some really great notes. So you're going to become his best friend, I'm sure. But just wanted to say thank you all. And if there's any questions.
Congratulations, Kelsey.
I'll be incredibly brief. We're waiting for the no photo drop. We don't know when it will happen. And we are tracking the many federal changes that are coming down the pike, and we'll send them out to the COC as we have been doing.
Thank you, Allison. And Kelly.
First off, I'd like to say that I'm just as disappointed that Hannah's not here as all of you. She is back from maternity leave, but unfortunately is not able to be with us. So one last go around with me. You should all have the report for you in front of you with HMIS data. I'm not going to read through it. We don't have a whole lot of time. Just two things to note. First, we last month had to take off the mission data because we identified some issues with the import. We have fixed that, and we are waiting for those fixes to come through on the next imports so that we can make sure that we are providing you accurate data. That data will be back next month. So it was a simple little flaw. We didn't realize we weren't pulling from back far enough to get the correct data. Beyond that, I do want to give a huge shout out to our July top housing agencies, which were Operation Stand Down with 19, the Salvation Army with 10, and Matthew 25 with 9 that they house. So great job for those agencies. Are there any questions about?
Thank you, Chair. I've got questions about data. So I've talked about this one for a while, the days to housing. I noticed that was cut in half in July. We're down to 88 days. Could you attribute to what changed in the last month?
I wish I had an answer on this. Hannah and I both looked at it a couple of times, reran it to make sure that it was true. The best that we can kind of guess is that the individuals who we were able to get into housing through the different agencies were relatively new into their programs before they left for housing. But there was no real uptick in the number of subsidies or anything that really stood out in the data to say why it dropped so drastically this month.
Thank you. Yeah, and I really harp on that one just because it's so important. You give somebody a ton of hope if they see a light at the end of the tunnel. So it's important to celebrate the wins. Thank you.
Yeah. Any other questions? Thank you.
All right. Well, I appreciate everyone's patience. We went a little over, but thank everybody's presence and questions and comments. And so with that, we will adjourn our meeting today. Thank you.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.